Assalamu alaikum wa rahmatullahi wa barakatuh. Respected brothers, sisters, viewers, Jazakumullahu khaira for your time. We will start the program just after a brief recitation of the Quran. So if we can get your undivided attention during the Quran recital, and then we will begin with the program today. Jazakumullahu khaira wa ahsanul jaza for your focus and giving the utmost respect and attention to the recitation of the Quran by our young Hafiz Ammar. Jazakumullahu khaira.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم اعلموا أنما الحياة الدنيا لعب ولهو وزينة وتفاخر بينكم وتكاثر في الأموال والأولاد كمثل غيث أعجب الكفار نباته ثم يهيج فتراه مصفرا ثم يكون حطاما وفي الآخرة عذاب شديد ومغفرة من الله ورضوان وما الحياة الدنيا إلا متاع الغرور سابقوا إلى مغفرة من ربكم وجنة عرضها كعرض السماء والأرض أعدت للذين آمنوا بالله ورسله ذلك فضل الله يؤتيه من يشاء والله ذو الفضل العظيم ما أصاب من مصيبة في الأرض ولا في أنفسكم إلا في كتاب من قبل أن نبرأها إن ذلك على الله يسير لكي لا تأسوا على ما فاتكم ولا تفرحوا بما آتاكم والله لا يحب كل مختال فخور الذين يبخلون ويأمرون الناس بالبخل ومن يتول فإن الله هو الغني الحميد صدق الله العظيم.
إن الحمد لله نحمده ونصلي ونسلم على رسوله النبي الأمي الكريم أما بعد السلام عليكم ورحمة الله تعالى وبركاته. Respected brothers, sisters, viewers, Jazakumullahu khaira for taking your time out today and joining us for this brief seminar. Respected brothers, sisters, viewers, as you would know, the media is swarmed with daily information on the status and the spread of cases of the coronavirus. So we are informed on a daily basis with regards to the situation with the coronavirus. Within our communities as well, we have this information, but along with the correct information, there's a lot of misinformation. There's a lot of conspirational theories. And we would like to use this platform of the masjid to be able to correct this information. And for this purpose, we've invited a few medical professionals and also a Sharia advisor, a specialist consultant in Islamic Sharia, in Ifta, in Fatwa, Mufti Sarfraz, who will be joining us shortly, inshallah, to discuss the issues surrounding coronavirus, which are important for us to know. Most particularly, we'll be talking about the current situation with the coronavirus, its spread, and how it affects the individuals, how the individuals are affected, and how the symptoms are manifested, how they are managed at home and also in the hospital. So this presentation is going to be delivered by our first presenter, Dr. Imran, and then we will also spend a bit of time going through the frequent questions within the community and addressing some of them, and we will be giving you the opportunity to ask questions from the medical experts as well, who are on the front line in Birmingham hospitals. And then we'll be going through the vaccinations, and particularly the Sharia or Sharia compliancy of the vaccinations and support, and we'll be having some question and answers related to that as well discussed. So the first presentation is going to be delivered by Dr. Muhammad Imran Bhatti, who's a senior consultant anaesthetist at Walsall Manor Hospital, who's going to be providing the introduction of today's presentation, and he's going to be talking you through how the symptoms of coronavirus are manifested on positive cases, on patients, and how they're managed in hospitals as well, and things connected to this. So without any further ado, I'm going to be inviting Dr. Imran to come forward and present his talk. Jazakumullah khairah.
Assalamu alaikum. A year ago, I was requested by my colleagues here to describe the precautions which are needed in COVID. It wasn't in my wildest imagination that we will come to this situation which we are now. I did present the precaution at that time, but even being a medical professional, I didn't have a clue that this thing can worsen so much. So the idea of program today is to give you some idea that as South Asian community, we are facing much more danger as compared to the other cohort. Secondly, I want to give you some idea, if you've not been exposed to or if you've not been aware of, about the patient journey if someone is affected by COVID. What usually happens in the start, what happens unfortunately if they need a hospital admission, and last but not the least, if the patient do deteriorate to be admitted to the intensive care unit, what are the likely treatments they are going to get. I'm not going to take much of your time. Hopefully, inshallah ta'ala, this presentation will help you to understand the key elements of this disease, and inshallah will help you prepare to combat this, inshallah. To start with, I'd like to show you a video, just a short video, just give you some background to this illness, that how it affects us. Okay, no problem. I think we are facing a bit of difficulty to run it. That's not a problem at all. I will send you a link later on. To start with, what I'll cover is that what we are facing as a country. Then secondly, I'll cover what we are facing as a community. So to start with, just to give you some idea, 1 in 8 adults have now lost a family member or a relative in our country. Just to bring you in perspective, this is the biggest loss of lives since World War II in UK because of any major calamity. 1 in 5 families have lost someone who is known to them. We are unfortunately the 5th nation in the world to surpass 100,000 deaths. Already we have lost 103,000 people, which is a figure from 2 days ago. And a conservative estimate is that we are going to lose another 50,000 people before this pandemic finishes. That might not, unfortunately include the care home deaths. We are really unfortunate to be the number 1 in the world in terms of deaths per 100,000, per 1,000. So it is a huge question mark, unfortunately, huge question mark, that why is that the case? There are multiple factors. Some of those are attributed to weather, late travel restrictions, delay in bringing up the preventive measures, and our too soft attitude among us as governors. So just for your information, if somebody is living in Germany, so compared to us, we are twice as likely to die as compared to someone living in Germany. And worse so, we are 30 times more likely to die anybody who's living in an Asian country like Vietnam. So these are solid statistics from reliable resources. So what is happening in our community? The latest statistics are, though from Black, Asian, minority and ethnic background, we account for 10 to 14% of the population. The intensive care occupancy is 25%. I wonder it is actually higher, because what I see in intensive care on day-to-day basis is alarming. I have seen husband and wife at the same time in the intensive care. I've seen neighbors at the same time. I've seen husband being discharged and wife being admitted. I've seen all kind of scenarios. And it has involved all age groups. The virus doesn't see the age. In a single night, I've withdrawn on 3 patients. In my 15 years of experience in NHS, I've never had this kind of experience before. The incidence of this disease, and rather its gravity in South Asian community, is much higher. Just for example, our Bangladeshi brothers are 6 times more likely to die of this illness as compared to a Caucasian. The low-paid manual workers are more likely to die and get affected. And to be on this kind of sad side, our community is only 57% likely to take the vaccine as compared to 75% of the rest of the population. Now, what are the general risk factors? I'm pretty sure most of you are aware, but they are definitely age group, higher age group, a person who is on immunotherapy, suffering from cancer, obese patients, major illnesses, common illnesses which are extremely common in our South Asian community, like high blood pressure, heart disease, diabetes. They are extremely vulnerable. Last but not the least, which we really need to be aware of, are the pregnant patients. At this point in time, we have got, which I can't reveal, a certain number of pregnant patients affected in our hospital, admitted already. I can't tell you that how difficult is this group is to be managed. They worsen extremely quickly, and 2 lives are at stake all the time. So what happens in this illness? So the common symptoms of this illness, if you ask someone who's been affected, would tell you that they haven't seen such a kind of illness before or not been affected before. The common symptoms are high-grade fever, extreme lethargy, nausea, vomiting, loss of taste and smell. However, the grave sign is breathlessness. You know, if somebody complains of shortness of breath, is difficulty to breathe, that's where we really are concerned. Now, at what stage patient need hospitalization? For us as people who are medically trained, it's different, but for any lay person, the one thing which I would say is breathlessness. If somebody says to you who've been affected by COVID or these symptoms and says to you that they're finding it difficult to breathe, it should raise the alarm. It's a red flag. There's a very small instrument, very easy to buy, called a pulse oximeter, which I'll strongly advise for everyone who is hearing this to buy, easily available on Amazon, that will give you the percentage of oxygen in your blood. As far as it stays above 90%, you are safe. But the moment it starts shifting towards 90 or below 90, then you need hospital admission. So other things that necessitate the admission are low blood pressure, very high heart rate. And what we do during the early hospital admission is oxygen, give fluids, antibiotics, an antiviral called remdesivir. We provide some anticoagulation, by which I mean that we give some drugs to avoid clot formation in the body. And on the top, we also help them with steroid, which has been proven to help in the initial stage. They can be given up to 10 days. Prone positioning, lying on your belly, helps a lot because it promotes even distribution of oxygen throughout the lungs. Now, something I really want to share with you, which is heartbreaking for me when I observe this, is from the moment one is admitted in the hospital, the relatives are barred from seeing them firsthand. You are contactable at the patient on FaceTime or phone, but you won't be allowed to see your loved ones in most of the cases. And I find it very difficult when I have practically seen this, that the patient who came to hospital with COVID said goodbye to their relatives, and the next time the relatives would see them is when they're passing away. It's really heartbreaking. But this is the reality. What happens in the intensive care? If the patient deteriorates, if they are unable to be supported just by oxygen and the measures I've just explained, they are taken to the intensive care unit, supported with a tight-fitting mask or a hood to promote the oxygen distribution. If that doesn't help, they have to be put on a breathing machine and sedated and put into coma. And that is the stage we really get worried about the patients. We keep on proning them, we keep on doing all the medicines I've told you before. We keep on supporting their different organs, but the mortality, by which I mean the direct death rate, is extremely high. In states, in the first wave in the United States, the percentage of people who went onto the ventilator and died was 90%. In UK, we are waiting for the fresh statistics, but it's as high as 70%. So 7 out of 10 people who will go onto the breathing machine will not survive. I'm not here to scare you. I only want to focus on the last statement. Prevention is better than cure. We should do everything in our capacity by the help of Allah subhanahu wa ta'ala to prevent this disease affecting us, our family, our loved ones before it's too late. Thanks very much. Jazakumullah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallahu khairah to Dr. Imran for this very informative discussion. So now we're going to move on to the next section. As I mentioned earlier, we are going to have Dr. Atiq Sayyid come forward, and he's going to be going through the frequently asked questions or the common questions we have in the community, and he's going to be addressing them in an informed way. And just a reminder, we note some comments, whether they are from trolls or whether they are genuine, on YouTube Live. Please be respectful in your queries and your comments. If you genuinely have some questions, they will be addressed. If we find that they are troll-based questions, they will be ignored. So whatever information we're giving from the member here, we're in the masjid, are being given by professionals. Even myself, I'm stage secretary this event. I'm also a scientist with a master's in immunology and infection, and have gone through very recently the tough end of the COVID virus symptoms, and stayed in hospital for a period of time. So it's a very, very serious pandemic. It's a pandemic. It's there. It's within the community, and we need to take it seriously. Hence, we're having these professionals come and advise us. So we're going to be addressing some questions now. We have some questions that Dr. Atiq will be sharing with you and then giving answers. And then we will also take some questions on YouTube Live. And like I said, if they're genuine questions, we will take them. Otherwise, they will be ignored. Jazakumullahu khair wa ahsan jaza for your respect.
Assalamu alaikum wa rahmatullahi wa barakatuh. Following on from Dr. Imran's presentation, I thought it would be probably better for me to go through the common asked questions. These are the real ones which I get asked again and again in the community. So I will go one at a time, and if there are ones which I haven't touched upon, then you have got time in the last 15 minutes. So the first question which has commonly been asked is, my father is suffering from COVID. I do not want him taken to the hospital, he will be left to die. So this is a myth or the common concern among our community, that the hospitals are full of COVID. So if our relatives, especially the elderly ones, have got COVID, whether they will be taken care of or will be treated. As Dr. Imran mentioned, I think the journey is, the answer for this is no, you have to seek medical help. All the patients who come to the hospital at the present moment, at the entrance, they will be having a swab to check whether they are COVID positive or negative. Once they've swabbed, within half an hour, we get the results, and depending on whether they're positive or negative, they will be allocated, well, it will be going in the green zone or the red zone. And everybody has got a protocol in terms of the management of COVID, as Dr. Imran mentioned, and generally speaking, everybody gets the same treatment. So I think the notion that the patients who come to the hospital are left to die is wrong and is baseless. And because we deal on a day-to-day basis and we see all the patients, every patient gets a plan in the morning, to an extent that all our outpatient activities have been cancelled because of the surge of the cases, and everybody are on the front door. So all the patients we see, by and large, are COVID-related. Everybody gets seen and they have a plan in place. And on the same day afternoon, because we do not have relatives coming to the hospital, a member of the team will ring up the family and explain the situation of the patient and the prognosis and so on. So the question here is, I think, if the patient needs to be seeking for help, they really should be going to the hospital, or at least ring up the GP or 111 or 999, depending on the severity of the illness. The next question, what should I do if I have chest pain? I suffer from angina or ischemic heart disease. I'm worried that I will catch COVID in the hospital. The answer is, I think what's happened, especially this came into focus in the first wave, quite a few patients, they get worried that if I go to COVID, I'll catch COVID in the hospitals. So even in serious circumstances of somebody developing chest pain or stroke-like symptoms, they do not seek medical help. To an extent, we have seen people dying of heart attacks in the community. So again, the answer is, I think you should seek medical help like you would have taken before the COVID situation. So symptoms like chest pain, symptoms like stroke-like symptoms, or symptoms including clot in lungs, these are symptoms which are very serious and can be manageable only in the hospital. So again, the answer would be that in medical emergencies, they should seek help as they would in other circumstances. The third question is, can you explain the do not resuscitate order? Doctors from the hospital rang to say that they will not resuscitate my mother. Again, this is a very common question which comes from especially the South Asian community. It's very, I have had personal experiences in terms of explaining the situation. To just put it in a brief, it does not mean that the treatment is stopped. It is a discussion, and this has become more prevalent during the COVID times, that when a person comes into the hospital, there is something called do not resuscitate form which we go through with the patient. There are quite a few. It's a document a discussion between the patient and the medical team looking after the patient. And there are quite a lot of circumstances which go through in terms of the age of the patient, whether the patient is frail, whether the patient has got any other comorbidities like heart failure, kidney disease, different other have had previous strokes, and what was the quality of life of the patient, how much could the patient would have walked without feeling breathless, what is the exercise tolerance. The do not resuscitate order just means as to what is the level of ceiling of care which one will be provided to. Whether the patient will be given all the medication, but in spite of the medication being given, if he cannot breathe on his own, or if he has a respiratory arrest, as we say, or if his heart stops for any reason in spite of all the treatment, then the decision has to be made whether there should be a CPR, cardiopulmonary resuscitation, on that patient, or whether the patient will be fit enough to go to ITU. Because once the patient goes to ITU, there are several other circumstances you have to think about it. Whether the patient will be weaned off the ventilator once he gets well, or whether the patient will be on the ventilator. Whether a patient who goes into a cardiac arrest, if his heart gets revived, will the patient have the similar sort of, in terms of his illness, whether he will be in a vegetative state, or whether he will survive a CPR, because obviously CPR is not for everybody, cardiopulmonary resuscitation. So the bottom line is, do not resuscitate does not mean that the treatment will stop. It just means that the ceiling of care will be provided or discussed with the patient. And if the patient is confused, if the patient's got a history of dementia, then the next of kin will be spoken and discussed with us. And in terms of this, a mutual agreement between the patient or the family along with the doctor looking after the patient, and then a decision will be made regarding the screening of care. Then going through some of the questions regarding vaccinations. One of the questions was whether the vaccine may modify your DNA. Especially there are several vaccines now in the market. Some of the initial vaccines, especially the Pfizer ones and the Moderna, uses the messenger RNA. And there are other vaccines which work differently. The answer is there's no way the RNA can change the DNA of anyone, because the messenger RNA basically works outside the cell, and the DNA is in the nucleus of the cell, so the messenger RNA doesn't enter the cell to alter your DNA. And the messenger RNA, after doing its work, it gets destroyed in the body very soon. So the answer is there's no way that your DNA gets modified with the vaccinations. The next question is, can one get COVID from vaccine? The answer is no, you cannot get COVID from vaccine. The normal common symptoms which you normally get with vaccination, as with any other vaccination, is normally a low-grade temperature, pain at the arm side, and headaches. This is slightly more worse than the flu jab, which normally, if some of them who have taken would be aware of us. If at all, if somebody gets COVID, it is likely that the patient would have had COVID just before he would have had vaccination. And by and large, normally you wouldn't get a COVID with the vaccine. And that's the reason why I think you are recommended to take the vaccination if you are eligible. The next question is, can you get COVID after the vaccination? You could. The answer is yes, one can get COVID after vaccination. We've had colleagues who've had COVID after 2 to 3 weeks after the vaccination. The way the immune system works, it takes some time, sometimes days or weeks before the antibodies develop in one's body. So sometimes you can get COVID 1 to 2 weeks after the vaccination. And as with any vaccine, it is not 100% effective. So the common assumption is that if you get vaccination, you shouldn't get COVID. That's wrong. You can get COVID, but the whole idea of getting vaccination is that hopefully if one gets COVID, it will be a milder form of illness. And the whole idea of getting vaccination is, one is to protect you from the serious complications which occurs with the COVID. So that's the reason why I think vaccination is recommended. The next question is, do I need vaccination if I've already had COVID in the past? Everybody works differently. The antibodies formation after vaccination differs from person to person. Some people have a significantly higher percentage of vaccination antibodies compared to some who have had hardly any. Currently, it is recommended, even if you've had COVID in the past, the current advice is to wait for 4 weeks after having COVID before having the vaccine. The next final question is, COVID vaccines can make you infertile. This, I think, was, there was a brief article going on with a German epidemiologist who suggested that it might be, but there was no evidence. So the answer is there's no evidence to suggest that COVID vaccines causes infertility. There have been instances where they were pregnant, there were women who were in the trial groups who had been given the COVID vaccination, and later on they have been found to have had pregnancy tests which have been positive. So there is no evidence to suggest that COVID vaccines causes infertility. But currently, I think we do not recommend pregnant women to have a COVID vaccination unless they are in a high-risk group, but we normally would encourage them to discuss with their local GPs. I think that finishes my version of the question, but if there are any further questions, I think I've deliberately left the ethical questions regarding the vaccination because Mufti Saab will be answering that. And as a whole panel, we will be more than happy to answer some of the questions which are coming through the YouTube. Yeah. I think there was one question which is in terms of discussed about autoimmune diseases, whether you can develop autoimmune conditions, whether they can develop or can worsen after vaccination. Again, there's no evidence. I think by and large there have been 10 million people who already have vaccinations. And previously we've had vaccinations, so there's no definite evidence regarding this. And again, every individual is different, so if somebody has got chronic debilitating diseases or if their autoimmune system immune system is low, they are normally encouraged to have the COVID because they will be in the high-risk group. Thank you. Assalamu alaikum.
Jazakallahu khaira for Dr. Atiq, who's a consultant endocrinologist in the University Hospitals in Birmingham, working in Heartlands and Queen Elizabeth Hospital. Again, both medics are frontline, leading huge teams in this battle. And also involved with the masjid. Dr. Imran is one of the trustees, Dr. Atiq, one of the senior members as well, with the rest of the team. Now we're going to move on to another aspect of today's seminar, and that is the Islamic position on vaccinations particularly, and also COVID and any other Islamic ethical issues. And for that we have our guest speaker, Mufti Sarfraz Muhammad, who doesn't really need much of an introduction for the regulars at the masjid, but for the wider community who haven't heard of him. So Mufti Sarfraz Muhammad runs a fiqh council, so known as FCB, Fiqh Council Birmingham, and he's also the Sharia advisor to the Halal Monitoring Committee, HMC, and also advises many pharmaceutical companies on halal products. I believe he has a pharmaceutical background as well. And with regards to his Sharia background, he's worked with many international fiqh council boards and has worked with reputable scholars, and is a student of Mufti Taqi Usmani from Pakistan, who's world-renowned, and has worked on a number of research theses on medical ethics. So without any further ado, I'm going to be introducing him. He's joining us not from the masjid, but from another location, and hopefully, I believe he's connected. Yes. Okay, we're going to try bringing him in and proceed, inshallah. And we'll have the joint question and answers at the very end, inshallah. So probably another 15-20 minutes of his presentation, and then we'll move on to the questions to the whole panel. Jazakumullahu khaira for your attention.
بسم الله الرحمن الرحيم الحمد لله وكفى والسلام على عباده الذين اصطفى أما بعد. Hopefully the sound is okay. I'll just wait for the confirmation from the chat section if there's a problem with the sound. Okay, seems to be sound is okay. Now, this section of the presentation essentially is going to focus on these three areas, and there have been a lot of questions regarding the permissibility or otherwise of vaccines. So I'm focusing essentially on the Islamic perspective, but I take on board what has been mentioned thus far with regards to the medical issues which are taking place across the UK and across the world as well. So that has a bearing on Islamic rulings as well. So in terms of the context from an Islamic perspective on medical treatment, this verse from Surah Shu'ara really encapsulates the Islamic perspective on ill health, that is part of life. The verse mentions about Ibrahim alayhi salam, that he made this statement that God is the one who guides me, having created me, he gave me food, drink, and if I become ill, and here the word is used idha maritu, meaning specifically when I become ill, he is the one who cures me, and then when I die, he will give me the life in the hereafter. So this verse really puts into context that ill health is part and parcel of life. And the concept of shifa is in the verse. And Ibn Kathir, famous commentator on the Quran, he also explains very important point here, that the issue really of ill health is that it is, like I say, part and parcel of life. We are anticipating that ill health will occur. So then the question arises, what do we do? Now, the hadith in Sahih Bukhari gives us an idea with regards to our psychological approach from an Islamic perspective. What has come regarding the expiation of the ill person? And the Prophet, peace be upon him, mentioned that Muslim is not afflicted with hardship, no illness, no concern, sadness, or harm or distress, even to the extent of a thorn which pricks, except that Allah, God, expiates his sins by these things. So this shows the fact that there is a greater purpose behind ill health and difficulties and hardships, and this hadith clarifies that for the believer. And the reward for the patience and not complaining about the difficulties one's facing. Now, here there is another aspect which um, really speaks for itself, in the sense that you have encouragement for seeking cure. That God has not caused an illness to be sent down, except that He has sent down its cure, shifa. And then this will indicate that there is an encouragement to seek cures and treatments for ailments, including conducting medical research. Now, are we required to take cures and remedies, or is it a recommendation? The hadith in Bukhari clarifies that the ulama have, the scholars have looked at the concept of medication as recommendation, because of an incident where a lady came to the Prophet, peace be upon him, and asked about her own ailment, which was epilepsy. And then the Prophet ﷺ gave her the choice either to seek a cure, or that she would be patient with it and gain the rewards. And so the giving of the choice indicating that it's not a requirement. And this has been mentioned in the commentaries of Bukhari. As for medical treatment being a form of, you could say, conflict with tawakkul, reliance upon God, here Imam Ghazali mentions that no, this isn't the case, because we know the Prophet, peace be upon him, himself took medical treatment, and he is a Sayyidul Mutawakkilin. And so, therefore, we do not consider it as conflicting with tawakkul, rather, it's part and parcel of life. And so, Hafiz ibn Hajar mentions medical treatment does not conflict with tawakkul, just as eating and drinking to remove hunger and thirst does not negate tawakkul and reliance upon God. Role of medical experts, we've discussed briefly the points with regards to how the issue of COVID, etc., has become a pandemic. And yes, you have conflicting voices who challenge that. However, that is a minority position, which, in the face of the scientific evidence generally accepted by the global community of scientists, as well as the pandemic in terms of the deaths caused, that's not really disputed in mainstream discussions on the issue of COVID. The preponderance of thought, Ghalibul Dhan, is what is really going to guide the Islamic ruling as well. So, what the medical opinion, you could say the vast majority of medical opinion, whatever that holds as terms of the threat and the need, haja, then that will be taken into consideration. Now we come to the issue of how are we going to assess the vaccine COVID-19? Well, the answer from an Islamic perspective is just like we assess other vaccines, like the MMR vaccine, the fluenza vaccine. Likewise, you have COVID 19, and then there are many different types of COVID 19. So, here I'm not going to talk about specifically one vaccine. We're going to deal with the general principles which can be taken into account. Sometimes a vaccine may include an impermissible ingredient, for example, a porcine gelatin type ingredient, or ethanol or alcohol. And then there are differences of opinion with regards to their permissibility or otherwise in food products. When it comes to medicine, medicine has its own ruling based on the fact that there is a need here which is beyond that of food where you have a choice to eat certain things or not. The medical issue is more in terms of haja, is more pressing need. So because of that, there are some principles in Islamic law that deal with the situation where any particular medication may contain an impermissible ingredient. One of those principles is tadawi bil muharram, where a person has, for example, a medication like a cough mixture, which might contain trace quantity of ethanol or something like this. And ulama generally have given scope for taking medication which may even contain a trace quantity of ethanol, based on the views of scholars like Imam Abu Yusuf mentioned in Fatawa al-Hindiya, that treatment via impermissible ingredient has been given, there is scope for that in Fatawa al-Hindiya. Likewise, Ibn Nujaym mentions in his text Al-Ashba wa Nadair that when there is a general community need, Al-Hajja Al-Amma, then that is considered as a necessity. Tanzilu manzilat al-darura. So obviously when we're talking about a COVID-19 outbreak, which is not really anything but a pandemic, global predicament for the whole world community, that pretty much is the majority position on it, then this would seem also to fit in with this rule, al-hajj al-amma tanzilu manzalat al-darura. So even if a given vaccine did contain something of an impermissible ingredient, because of the necessity and need which is widespread, then based on the principle of necessity, there would be scope on the basis of this principle as well. So that, in a nutshell, really deals with some of the points which have often been raised. And then I think if there are any specific questions, we can maybe look at those in the Q&A section. Thank you.
Jazakumullahu khaira again. Jazakumullahu khaira again for your time. Now we're going to move on to the question and answers. So like I mentioned earlier on, we are having a number of posts on the live updates. Many of them are famous conspiracy theories, factless points, whether it's with regards to the survival rate of the virus. I mean, you don't really need to be so informed to know rebuttals of these or real information or facts with regards to this. So there's a number of trolls, we believe, that are posting all sorts of points and questions. We want to move away from that. We will not be addressing any of those points because they've been addressed in the media, they've been addressed by medical professionals across the board. We're going to be addressing some of those questions and some which we feel haven't been addressed before now. So if you've got any specific questions to any of these speakers with regards to what they said, or any other questions, then please post them on the live comments section for all three speakers. So Dr. Imran, Dr. Atiq, and also Mufti Sarfraz. So we'll be spending possibly another 10-15 minutes on question and answers, and then we'll be wrapping up. So we'll proceed with this. Jazakumullah khair.
While the questions are being looked into it, I just wanted to address one thing. What this COVID has shown is the physical, in terms of the illnesses which are prevalent in the South Asian community. It is shown very starkly, especially the Bame population, that we really have to look after our physical health. In terms of the chronic illnesses which we have. This also goes on in terms of the way we live our lifestyle, the diet we have on a day-to-day basis, and also the amount of physical activity. But this has really shown very starkly when you look at the Caucasian population and the South Asian or a BAME population, where the patients presenting with COVID are younger, with lots of chronic comorbidities, including diabetes, hypertension, heart disease, and kidney disease. So I think it is a wake-up call for us, and in terms of to reflect on our own health as well, and to try to make sure that we look after our physical health, so that we stand a better chance in terms of fighting these viruses and future illness with the will of Allah subhanahu wa ta'ala.
There's one small point I forgot to mention. We have got quite a underused resource in the hospital. I'm pretty sure everybody is aware of that we've got Muslim chaplain in each and every hospital. But I've realized that this is only one of the cases the relatives took the help from the Muslim chaplain. They can be of huge help, especially if a patient is terminal. They can help in quite a few aspects. So I'll strongly advise that if unfortunately someone is in that kind of situation, if their relative is too ill, then they should take help from the Muslim chaplain. The way to contact is there's always a phone number available from the intensive care unit, or they can go to the switchboard. Thank you. We'll start answering the questions now. The first question is about...
Sorry, Imran, just to add that whilst Dr. Imran mentioned that no relatives are allowed to come to the hospital, in the event of terminal illness, when the patient is in the last throes of death, they do allow a single family member to be close to the near ones. And also, if the patient has got dementia, or if the patient cannot understand English or confused, in those circumstances, you could request the medical team looking after him or her, and in that circumstances, they will allow a family member to stay with the patient. Sorry.
So the first question Dr. Syed is going to answer is about the various other treatments specially being used for the prevention.
I think over the period of 9 months, there have been lots of medications which have come, which have shown to be effective. Some of them Dr. Imran mentioned in terms of antivirals. There are antibiotics which we've been using as well. In addition, vitamin C, vitamin D, multivitamins. There's no hard or hard evidence to suggest whether any one particular treatment works. To the effect that even the hydroxychloroquine initially showed some sort of effect, but now I think there is an argument whether it is really effective. The one medication which has been shown to be effective pre-hospital is colchicine. This is a medication which tend to use for gout to reduce the uric acid. This has shown to be effective in reduction of in-hospital admissions, also mortality as well. So that's, I think, the only currently before pre-hospital which is shown to be effective in those circumstances.
In terms of prevention, there are trials going on, and special mention should be about the vitamin D and vitamin C. If you ask me, I would take it. There's no harm in taking those medications, but we're still looking for solid evidence. The second question is about the sudden deterioration during COVID, i.e., a gentleman has asked that, sometimes the patients are quite stable during the COVID illness and suddenly they deteriorate and end up on the breathing machine. There could be various reasons. The first and the foremost is the ongoing illness which takes its toll, and because of the high inflammatory mediators, it starts affecting the other organs. Or it could be due to a condition called clot formation, in which the body behaves in a way that the clot starts forming in different parts of the body, especially the lungs, which can be really detrimental. Or there could be failure in itself in terms of the exhaustion of the patient, which is the most common thing which we're observing, especially in the intensive care unit. When the illness is ongoing and the patient get exhausted, they look so stable for good even 96 hours. I've seen patients even 96 hours, they're pretty much the same. then they suddenly deteriorate because of the exhaustion and tiredness. The third question I'll request Dr. Syed to answer is about different vaccinations and their efficacies.
I think regarding the different vaccines and the efficacies, it's already there in the media. I don't think so we need to go into detail. The bottom line is, I think so the vaccination is, I don't think so we will have enough vaccines to vaccinate all the population. And I don't think so we will be in a position to choose which one we will be having it. So I will leave it to the individual when they go and discuss with their own local doctor. But by and large, at the present moment, it is likely you will be offered a vaccination and you have to take it. There's no, I don't think so there will be a choice of which you can prefer because of the shortage of vaccinations. But I don't know what will happen in the future. But at the present moment of time, it is whatever vaccine is available will be given to the person.
Okay. Do you want to check? Is there any other question?
Okay, if if you have already got any burning questions, we'll have another 2-3 minutes.
One thing I would really like to mention is that whatever medication we use in the hospital, it's all evidence-based. And one has to really be sure that the medicines being given are helpful rather than being harmful. So they undergo very strict regulations before they have been allowed to be administered. There is huge pressure from the relatives to use different type of medications which are not yet been properly trialed and has been proven to be of benefit, and which as intensive care consultants and aesthetic consultants we won't allow to be administered. Same from the physician side. So until it's been established and gone through the main federal regulatory bodies, we won't allow them.
Okay, I think we have basically no new question. So I think I'll leave to Hafsab to summarize. Just one last thing I would want to add on is in terms of as a community, I think one is we should follow the law. And I think there's a good reason why the social distancing and the hand sanitization and everything else is in place. I have a few anecdotes in terms of the community where happened. A family came back from abroad, and the next couple of days you see the children in the school and people going to work. I think this is one is against the law, and I think ethically, I think it's really not recommended. When we have to self-isolate, we self-isolate. Because basically sometimes we feel that we are young, we won't be getting a severe illness, but we will carry the virus and we become vectors. And there will be vulnerable people in a family or in our own household which we will infect them. By and large, lots of our own families, we have 2 generations, 3 generations living in our houses. So I think we should really make it a habit or make it a point that we not only we will follow the guidelines, but also make sure that other family members in our household also follow the guidelines.
Thanks very much for
Jazakallah
listening.
khair,
Thank you.
inshallah.
Take care.
I'll leave Hafsab to
Assalamu
just